you ever thought that a change of a number can improve or decline your health status? I am very knowledgeable of how to take a blood pressure from my instructors in nursing school, books, and other websites that I have read. Taking someone's blood pressure with an accurate finding is very important, especially if they have a history of high blood pressure. Tonight, I'll be telling you about what you will need to take somebody's blood pressure, how to position the blood pressure cuff and your stethoscope, and also how to read and take your blood pressure. So first, I'll start by telling you what you will need to take somebody's blood pressure. So you'll need a stethoscope. Then you will also need a blood pressure cuff with a sphygmometer on it. The sphygmometer is a dial that shows all the numbers to be able to hear the beats. So next, I will be telling you how to position your blood pressure cuff and your stethoscope for taking blood pressure. So you have your patient put their arm on the table or the bedside, wherever they are. Have them relax. Then this is their left arm, so you'll be using the left arm arrow right here on the blood pressure cuff. Most blood pressure cuffs have this on there. And then you also want to make sure, especially if it's a woman, that if they have you look in their history, and if they have had a mastectomy, then you want to make sure that you do that on the opposite side than where they had that. Okay, and then you want to make sure that this blood pressure cuff is snug but not too tight. Then I like to tuck this extra flap under the dial there just to make sure it doesn't get in my way whenever I'm reading those numbers. And then this knob here, it deflates the blood pressure cuff. You turn it that way to deflate it, and then you make sure it's tightened all the way to be able to inflate it. And then for your stethoscope, you want to make sure that the buds are facing away from you, so that way you'll be able to hear better. And then you want to position your stethoscope right on that brachial artery to be able to hear it. Then you want to ask them what their normal is, and you always go 20 above what their normal is. So what's your normal?
120 over 80.
Okay, so that is within normal limits. So you would pump it to about 20 above that, and then you will slowly start to deflate it. And then once you hear that first thud, that is going to be your systolic pressure. And then you'll hear it slowly start to fade away, and once it fades completely away, that very last thud you hear is going to be their diastolic pressure. Okay, so we're going to go ahead and take it. Okay, so your blood pressure was 128 over 82. So it is within normal limits, so we are good there. And then you are good, and you can put your arm back. In conclusion, it is very important to get an accurate blood pressure finding, especially for somebody who has a history of high blood pressure. Tonight, I've told you about what you need to take a blood pressure, how to position the blood pressure cuff and your stethoscope, and also how to read the dial and take the blood pressure. Lastly, blood pressure is very important because the higher your blood pressure is, the higher risk you are for health problems in your future. If your blood pressure is high, it's putting an extra strain on your heart, the arteries of your heart, which could eventually lead to a stroke or even a heart attack, so you want to be very careful of that.